In this training video, we are going to learn how to support a choking child. Choking is potentially life-threatening in any child, from newborn up to the time they are grown-up teenagers. On what things the babies can choke on? There are multiple things on which the babies can choke on. Starting from the newborn period, a newborn may choke on breast milk, vomitus, or simply a plug of mucus. And you'll be able to witness that they stop the ability to cough and they will struggle to breathe, and sometimes you may even see gasping. And if you take an older child or a toddler, there are various things, objects on which those toddlers can choke on. If you take food particles, examples include the pieces of grapes and the pieces of sausages. And other objects like button batteries and small objects, lollipops, and various other buttons and small balls and even coins can result in a fatal aspiration. Therefore, it is important that you are skillful enough to support such a child if you encounter them by the roadside or any other place where you visit. Let us understand the correct approach to giving life support to a choking child. The scenario would be that somebody has witnessed a child who has choked on a toy or an object and now struggling to breathe. First of all, assess whether the child has got effective cough. If the child has effective cough, it means the child is able to cough out the foreign body. And the correct approach in such a scenario would be to encourage cough. This may not be the case in all scenarios, and sometimes the child will be conscious, however will have gasping like breathing and will have a really difficult breathing pattern. And in such case, you need to give life support to help the foreign body come out. And here we use the technique of giving back blows and chest thrusts. And in other scenario, the child may be unconscious and the child's airway will be at severe and imminent risk of collapse. And in such a scenario, it is not appropriate to continue giving back blows and chest thrusts, but rather you have to start giving basic life support, starting from protection of the airway and giving cardiopulmonary resuscitation. Look at this child who has choked on a foreign body. You can appreciate the child has got effective cough. The correct approach in this scenario is to encourage coughing. If the child has ineffective cough and gasping type breathing but remains conscious, that is an indication to immediately commence giving back blows and chest thrusts. Let us understand how we can correctly deliver back blows and chest thrusts. A choking baby who has not got effective cough needs to be supported in one of your hands like this. And note how the child is positioned. The head is placed lower than the bottom is placed. And you have to support the child's head and the body with one hand. And use the other hand, the heel of the palm, to deliver strong back blows in between the two scapular blades. And you deliver the 5 back blows in succession. 1, 2, 3, 4, 5. If you witness the foreign body is expelled from the child after a couple of back blows, you may stop giving back blows. However, if the child remains struggling to breathe and you can't witness any foreign body, you will have to complete giving the 5 back blows. After you give the back blows, turn the child to the other side and look for evidence of foreign body in mouth. If there is a foreign body visible, under direct vision, you can remove it. However, never attempt to give blind finger sweeping, as it can push the foreign body further inwards and result in a complete obstruction. And if the child remains having ineffective cough and no foreign body is passed, then you have to give 5 chest thrusts. So chest thrusts are given on the center of the sternum with your index finger and the middle finger. Again, support the baby on your palm and keep the head low, and note that the bottom is placed at a higher level than the baby's head, and support the head with one hand. And with your 2 fingers, the index and the middle fingers, give firm chest thrusts on the center of the sternum. 1, 2, 3, 4, 5. By giving chest thrust, you expect to squeeze the lung and then push the foreign body upwards and towards the upper airway. Let us see how you can deliver chest thrust to an older child who has choke on a foreign body. If the child is able to stand up, you can support with one of your hands and deliver the chest thrust using the other hand. In giving the chest thrust, you will have to use the heel of your palm to deliver the chest thrust on the center of the chest. 1, 2, 3, 4, 5. Here you apply upward pressure with the intention of squeezing the lung tissue and pushing the foreign body upwards in the airway. After giving 5 back blows and chest thrusts, and they are given in succession, your child may recover. Upon recovery, keep the child in the recovery position and arrange transportation of the child to the hospital. Sometimes the child may not recover and the foreign body can keep collapsing the airway, and your child can collapse. In such a scenario, the child can become unconscious. In an unconscious child, giving back blows and chest thrusts is not appropriate, and you will have to commence basic life support starting from protection of the airway. Refer to the video on giving basic life support for a child who is remaining unconscious after a choking episode.